There hasn't been just one moment or experience that made me decide to become a doctor. A lot of individuals have impacted my decision, and several events have shaped and molded me into the kind of physician I want to be. I knew I wanted to get involved in healthcare after the summer of 2000. I was about to start my senior year of high school in the fall, and my family decided to take a trip to India. I learned fast that life over there is not like a Bollywood movie. Pollution, poverty, lack of sanitation services were just a few of the issues that I saw prevalent in the country. But I think a defining moment for me on the trip was witnessing firsthand the disparities that exist for the poor to access appropriate care, especially with the pediatric population. When I was in South India, I had gotten a pretty bad allergic reaction to an insect bite on my left hand, causing it to swell up instantly. My uncle and I went to the nearest clinic, and I was seen in 5 minutes, and I was out the door in 15. There was a child in there, though, that had been waiting for an hour, and he had been vomiting uncontrollably. He was still waiting to be seen when I left. Being an American, I was immediately given preference to access care. Even though from all the other patients in the clinic, I was probably the least deserving of such care. I never felt so angry and disgusted with myself as I was that day. Halfway around the world, even in my own backyard in Georgia, I realized the same inequalities exist. Before medical school, I worked in the public health sector, and for a year, I traveled throughout the state, working with PE teachers and school administrators to study the health and fitness of their students. I witnessed the disparities firsthand of how difficult it was for a lot of these children to access appropriate health care, nutritional foods, and after-school activities in the less affluent region of the state. Since going into medical school, I've realized what it is I truly find incredible about the profession that I'm choosing to spend the rest of my life in. With every patient, I get the honor and privilege to get to know an individual. I listen to their most intimate secrets, successes, hopes, and regrets. Patients confide in a physician. That trust is a gift. I still remember the first patient I gathered a medical history for. He was a World War II vet who was on the beaches of Normandy during D-Day. As we recounted about the campaign, he teared up as he talked about how many friends had died. I had just known this gentleman for 30 minutes, but maybe he was looking for someone to listen. But I was humbled that he decided to share that part of his life with me. Similarly, when I was on my psychiatry rotation, I had met a young man who had lost a number of his family members in a tragic accident, and as a result, attempted suicide. An extremely talented writer, while he was on our service, he wrote a number of poems and essays to reflect the anguish that he felt, and he not only shared them with me, but asked for my opinion. I don't know anything about poetry, but again, that personal connection is something I look for in every patient I see. But I've come to find out it's not only in the hospital or while I'm wearing my white coat that I can be a confidant. A month before I started my clinical rotations, I went back to India. 10 years had passed, and from a public health standpoint, a lot of changes were noticeable. A lot of the clinics were using aseptic techniques, and sanitation services had dramatically improved. But this time I was there for my grandfather. My grandfather was probably one of the most independent men I'd ever met. He lived in a very small town in rural India, and even though he was in his 90s, every day he would manually pump water into his water tank, go to the market to buy the groceries, and visit the temple. He would do this routine every day without fail. But one day, as he was coming back from the market, he fell. Brushed it off, but a few hours later, he fell again. Brushed it off again, but when he fell for the third time, he couldn't get up. Couldn't even move half his body. He'd suffered a massive stroke, and it completely debilitated him. By the time I had a chance to go to India, 2 months had passed. The last I remembered him was from 2000, where he was a very strong, healthy man. But when I saw him now, he was frail and weak. There were no physical therapists in the small town he lived in, so his build and muscle mass had completely weathered away from not exercising. The brief time I spent with him, I immediately became his caregiver. I made him exercise so he would sit up in his bed without needing any support and be able to feed himself. I discussed with him the need to take his medicine and explained what each medication did and how it would help him. In his time of need, this man, who had never asked for help and never let his guard down, opened up to me. He shared his concerns about what would happen to my grandmother after he passed away, worried about the medical bills that were starting to build, how he wouldn't be able to see his grandchildren get married, how he might not be able to see all his children before he died. Halfway around the world, without being in the hospital, without wearing a white coat and having a stethoscope in my hand, in his last few days I listened, as I've done with all my patients. I think that's why I continue to pursue a career in medicine. Disparities exist all around the world, and I will work hard to steer my healthcare career to make sure everyone I encounter receives the quality care that they deserve. But beyond that, with each person I meet along my journey, I'm so grateful to be the one that they trust.